Hi, I'm going to be speaking a little bit about hepatitis A. What is it and how can we keep ourselves safe from it? Hepatitis A is a virus that affects the liver. This is important because the liver performs many functions for the body. It helps filter our blood, it helps us absorb nutrients, it helps us fight infections, and it has many other functions as well. If you become infected with hepatitis A, you may be fine for a long time. It may be weeks before you're going to see signs of an infection, and symptoms are different from person to person. Some people will get hepatitis A and they never have any symptoms. Other people will have symptoms. Those symptoms may be fever, nausea, vomiting, diarrhea, you may have joint pain, and because of the effect on the liver, you may have yellow discoloration of your eyes and your skin. This is called jaundice. How would we get hepatitis A? This infection typically spreads through contaminated food and water. So specifically areas that have poor sanitation or not good access to clean water are at much higher risk. The foods that we eat can become exposed to the virus as well, while it's growing, while it's being processed, while it's being prepared, or while it's being stored. If you're living in the United States, the number one risk factor for getting hepatitis A is traveling outside of the United States, specifically to areas where hepatitis A is more common. There are other risk factors as well. People experiencing homelessness, people using IV drugs, men who have sex with men have a higher risk of getting this infection. And if you have pre-existing liver disease or are elderly, you're at risk for having a more severe infection if you do get hepatitis A. How can we protect ourselves? Hand hygiene is extremely important. Washing our hands, particularly after using the restroom or if you're around either eating or preparing food. If you are traveling, avoiding cold foods and avoiding improperly washed or cooked foods is important. Avoiding unfiltered water is one thing that you can do to decrease your risk. And if you are in one of those high-risk groups, or if you're planning to travel outside of the United States, you can consider getting a hepatitis A vaccine, and you should speak with your doctor about this. You think you have hepatitis A, what do we do now? Almost everyone, 99% of people, fully recover from a hepatitis A infection. This is not a hepatitis infection that you're going to have for years and years. You do not get a chronic infection with this virus. If you think you have hepatitis A, you should seek medical care and follow your doctor's recommendations. They're going to want to do some lab work and they're going to want to monitor your liver lab levels to make sure that you're improving from your infection. It's important that you rest and hydrate yourself and make sure that the rest of your family members are aware, they're following precautions and getting vaccinated as well. Thank you.